Hello, everyone, and welcome to the 2022 Patient Conference. We're really excited to have you all with us today. And while we thought we might have been able to do this conference in person this year, based on your responses when we asked, everyone thought it would be better to do this year again virtually. So we've taken all of your suggestions from the last 2 years and incorporated into the program, which I'll talk a little bit about in a moment. Before we get started, I'd like to say a special thank you to our funding sponsors. Obviously, without their support, we would not be able to bring this fully robust program right to your computer and into your home today. I want to make sure that you take some time to visit our virtual booths. There's lots of really great information there that will be of value. And this year we've incorporated a fun little scavenger hunt to encourage you to take a look at all of the information that's out there. So take some time in between the sessions and check out the exhibit booths. Let's see, what else do we have? Oh, I really definitely want to talk about the 2 tracks that we've incorporated into this year's program. Based on your feedback, we've incorporated 2 tracks. So there's a track for early stage or newly diagnosed folks, or people that need a little more of the basics. And then we've added a second track for those of you who have been around for a while and are more interested in doing a deeper dive into research, clinical trials, what's on the horizon. So you should have registered for one of those tracks when you signed up. And if you are interested in viewing the other track, know that all of the presentations will be recorded and available after the program. Give us about a week to get everything up. Feel free to use the chat function. We also know that sometimes there's a lot of great interaction amongst the participants in the chat, and also want to encourage you to participate in the networking time that we have together, so that, again, it's hard in a virtual environment to create the same kind of in-person meet and greet, but we've done our best. But it only works if you participate. So I really encourage you to take advantage of all of the different peer-to-peer, the networking opportunities, and the chat function to engage with each other throughout the day. So I think that's everything about today. But I did want to mention that after the conference, we will have the open live question and answer session with the clinicians today, which is always one of the favorites. And we know we can't get to everyone's questions. So be on the lookout for our quarterly Ask the Experts programs. And also, we've incorporated some new ways of bringing that kind of frequently asked questions to your door, if you will, by doing these little mini videos. So be on the lookout for those. And in addition, we've begun to create topical compilation videos, which really are perhaps different perspectives from a number of clinicians on a specific topic. So you may have seen some of those come through. If you're not on our mailing list, I encourage you to sign up so that you get the emails with these new videos. And we've also created a playlist on our YouTube channel. I also would encourage you, if you enjoy the peer-to-peer kind of conversations, please think about participating in our monthly networking groups. They are 7 o'clock Eastern time, the first Tuesday of every month. And then also to highlight, we'll be hosting our second international patient program in September on the 9th and 10th. And as some of you may know, this disease crosses borders, right? So we're really doing our best to work with the international community and our colleagues and partners to begin to bring together the cutaneous lymphoma patient community around the world. We will also be later this afternoon announcing and sharing with you our 2022 Catalyst Research Award winners. As many of you know, if you've been with us before, every year we've been able to award 2 financial grants to support researchers doing wonderful work in the area of cutaneous lymphoma. I encourage you to join us for that presentation so you can meet the researchers and learn a little bit more about the research that they will be engaging in over the next year. So I think that's it. If we miss anything, you can always ask throughout the day. If you have any problems on the tech side, there's tech support available. So I encourage you to jump in, enjoy the day, learn, take notes, send us any additional questions or comments you may have after the fact. We really look forward to your feedback. And if there are things that we can do better, if you have ideas, please, please, please share them with us. And of course, after the conference is over, we're available anytime. If you need us, call, drop us an email, ask your questions. We're happy to support you in any way that we can. So with that, I will see you throughout the rest of the day. Enjoy the conference, and maybe I'll see y'all somewhere soon in person, maybe later this year. Okay, everyone, take good care. We'll see you soon.